Okay, I hope everyone can see me because I feel like the podium is a lot taller than I am. All right.
Never equate verticality with power.
Yes.
It's a big mistake.
Yes, okay. All right, so, hi everyone, I'm Sonia. My culminating presentation is on campus-based alcohol and substance use prevention programs and looking at these programs through a socioecological perspective. Oh, there, okay. Right, so I completed my practicum at the Center for Addictions Research of BC, or CARBC, which is a research affiliate of the University of Victoria. Unfortunately, I didn't get to spend time on this beautiful campus. I was stuck in downtown Vancouver, but still very good, very close to home. I worked on their Changing the Culture of Substance Use, or CCSU project, which is co-led by CARBC as well as the Canadian Mental Health Association of BC. And the CCSU project is part of the BC Healthy Minds, Healthy Campuses initiative. And my culminating project report was done on finding new ways to foster the dialogue and discussion surrounding alcohol and substance use on campuses. In order to talk about alcohol and substance use on campus, we should get to know the issue at hand. The information from the following slides was taken from the 2004 Canadian Campus Survey. So we'll start off with alcohol use on campus. According to the Canadian Campus Survey, 85.7% and 77.1% of Canadian post-secondary students used alcohol in the past year and the past month, respectively. Only 1 in 10 Canadian post-secondary students were found to be lifetime abstainers of alcohol, like me. The Canadian Campus Survey also studies the opinions and beliefs, as well as the perceived norms of students surrounding the subject of alcohol use on campus. The survey found that only 14% of BC post-secondary students considered alcohol use to be problematic on their campus, and approximately 44% of BC post-secondary students believe that drinking is an important part of the post-secondary experience. All right. Now moving on to substance use on campus, the Canadian Campus Survey found that 32.1% and 16.7% of Canadian post-secondary students used cannabis in the past year and the past month, respectively, and 8.7% and 2.2% of Canadian post-secondary students used an illicit drug other than cannabis in the past year and the past month, respectively, such as heroin, performance drugs, LSD, ecstasy, and other party drugs. All right. So I'm sure we all are aware of what the socioecological model of health is, but I'm also going to go over just a brief overview of it. But as we can see from the previous stats, alcohol and substance use is a very important issue that needs to be addressed by campus stakeholders. And during my time at CARBC, I worked on a literature review to consolidate the concepts and ideas put forth by various researchers on how to foster the discussion by utilizing the socioecological model of health. So the socioecological model of health uses an interdisciplinary approach in an attempt to understand how and why health behaviors occur. Because of this, it can be used to design effective strategies for health promotion, health education, and prevention efforts. I'm going to try to use this laser pointer. So it looks at multiple levels of influence, which are the intrapersonal, interpersonal, organizational, community, and policy levels. And in the next few slides, I'm going to go into a couple of details of these levels in relation to the health behavior of the use of alcohol and substances in the campus environment. All right, so we'll start with the intrapersonal level. This is also known as the individual level. This level looks at what factors influence an individual to become a user of alcohol and substances. Factors include biological characteristics such as gender, sex, and age, social characteristics such as education level, employment status, socioeconomic status, and living situation, psychographic characteristics such as values, beliefs, and attitudes, and personal history characteristics. Next is the interpersonal level, which looks at how the relationships an individual has might increase or decrease their risk of becoming a user of alcohol and substances. Influences include family members, peers, and close social networks. Studies have shown that social support plays a positive role in health behavior change and can help individuals to feel more in control of these changes. The organizational level or the institutional level is essential in the promotion of healthy behaviors to individuals. Factors include settings and institutions such as colleges, universities, and campuses, and the formal and informal rules and norms within a particular setting that can influence the behaviors of individuals involved in that setting. Next is the community level. Factors include the norms that exist within members of a community, the environments in which individuals live, and the resources provided by these environments. This level also looks at the climate that is created within the community where alcohol and substance use is either encouraged or inhibited. The last level is the policy level, which is also known as the societal level or the society level. Factors include cultural norms, policies, and governance. This level also discusses laws, regulations, and social campaigns that can affect populations and their use of alcohol and substances. We will now be looking at the ideas that researchers have put forth on how to use a socio-ecological model of health when creating and implementing alcohol and substance use prevention programs. Within my literature review search, I was actually only able to find one article that used a socio-ecological model of health on alcohol and substance use programs, so I had to extrapolate data from different studies that did it in physical activity and healthy eating. So that was kind of an adventure. All right, so we're gonna start with the intrapersonal level. Studies have found that some post-secondary students believe that alcohol and substance use has little to no effect on their health or their academic performance. So it's important to tackle these misbeliefs by educating students on the risk factors of these behaviors. And it's also important to teach skills in self-efficacy, such as providing training and guidance and refusal skills, and also techniques in protecting oneself from harms associated with alcohol and substance use. Okay, next up is the interpersonal level. Sorry, they're very similar. Studies have found that students involved in college social activities drink more alcohol and drink more frequently than students less involved in social activities. So this highlights the importance that an influence has on an individual's alcohol and substance use behavior. So we can use this influence positively by implementing peer education programs and appointing and selecting student leaders to serve as role models of appropriate alcohol and substance use behaviors. On the same lines, the drinking and substance use of family members can also have an impact on the behaviors of students. We can encourage parents to be role models for their children with emphasis on parents teaching their children about the risks and harms of alcohol and substance use. The University of Victoria has acknowledged the importance of the influence of parents. I had the honor of participating in a meeting with CARBC, CCSU, and UVic resident services, where it was proposed to create an information sheet for parents outlining the risks of drinking on campus to go home with students during orientation. With the organizational level, within post-secondary institutions, we can offer extracurricular activities and events dedicated to alcohol and substance use awareness to educate students and to create a positive, healthy environment. We can also limit accessibility to and decrease the use and sales of alcohol and substances in and around campus and promote anti-alcohol and anti-substance use campaigns via traditional and social media. Finally, the development of campus policies and regulations is also important, and this will be discussed in more detail, obviously, during the policy level. Next up is the community level, and the campus is a predominant community for students, especially those students that live away from home or live on residence. So we can encourage students to form youth advocacy groups, decrease the promotion and sale of alcohol and substances on campus, and again, appoint student leaders in the campus community to act as role models to other students. Lastly, we have the policy level. During the meeting with CARBC, CCSU, and UVic resident services, it was discussed of the development of a UVic campus alcohol policy. It has been found that campus policies can help to set guidelines and manage student behavior. And it's also important to have proper enforcement techniques to ensure that policies are being followed. Alcohol can also be restricted on campus during campus events, and there should be a focus on no alcohol or dry events on campus. At a wider level, increasing taxes on alcohol, reducing the density of retailers, and restricting the days and hours of selling can also help to decrease student alcohol consumption. So why use a socio-ecological approach? So as you can see from the quote on the screen, according to the Ottawa Charter for Health Promotion, health is complex and cannot be separated from other factors in an individual's life, which constitutes the basis for a socio-ecological approach to health education, health promotion, and prevention programs. We believe that using the socio-ecological model of health for alcohol and substance use prevention programs acknowledges the fact that behavior is multifaceted. The facilitation of multi-level cooperation among the various levels of the socio-ecological model of health will ensure a sustainable success for alcohol and substance use prevention programs on campus. Okay, so I would like to take this time to thank my supervisor, Dan Reist, and Dr. Tim Dick for their guidance during my time at CARBC and for helping me to understand how to dig deeper in literature. I'd also like to give a big thank you to my first and second reader, Dr. Catherine Worthington and Dr. Michael Hayes, as well as Betty Taylor and Victoria Barr for me sending them immense emails asking them questions about my practicum. So just thank you all for your help throughout the course of my practicum. And thank you for your time. And are there any questions? I see some hands.
Yes, questions.
What are your thoughts on the unintended consequences of increasing taxes on alcohol?
I didn't really get to that aspect in my literature review, but I think that most important is to decrease the density of retailers surrounding campuses and also to decrease the time and hours that they're selling. So if they are selling primarily during class time or they close down early, that way people going off of campus won't be able to access as much alcohol as they would be able to if they were more dense retailers around campus. And increasing the taxes on alcohol, I didn't really find anything about that in my research, any unintended consequences.
Hi, Sonia. I'm just wondering if you came across any, if you came across the use of study drugs during your research.
Yeah, that's the performance enhancing, like
okay.
Ritalin, that kind of thing. I didn't get into exact examples of it because my presentation or my project was mainly based on using the socio-ecological model of health, but there were increased usage of Ritalin and those kind of drugs so that people can study harder and get better grades. So I also think that it's also important for universities to understand the impact of not telling people that they have to get straight A's all the time. I think that it also will help if they can show them that it's not all about getting good grades. You can also just achieve a healthier lifestyle on campus.
Sorry, you're getting grilled right now. I was just wondering, I just forgot my question. Oh, right, okay. So the approach looks like it takes an all or nothing stance. Mm-hmm. Was there any kind of examination, like when you move to Alberta, you're 18, alcohol consumption is legal. Was there any kind of research or looking into the fact that like moderate consumption in social settings versus restricting completely and creating a dry setting?
Yeah, there were, that was just one example of things that a campus could do. During the meeting with CARBC, CCSU, and UVic Resident Services, they discussed student leaders utilizing a more moderate stance on alcohol consumption so that they could show how you can party normally. Like they had the Drink with Class campaign that they were talking about, just to show that, you know, there's a difference between having a couple of drinks and then dancing on a table at a party. So just having that fine line between, you know, good and bad behavior.
As I'm walking to the next question, I just want to comment that this weekend I was at my college reunion, and it gave me more appreciation for being so poor that I couldn't afford the epic drunks under which many of my classmates survived. But they had fun.
Good presentation. I'm curious, the study and it focused primarily on students, and I recognize that there's other adults on campus being staff and faculty. I wonder if there's any consideration to how that might influence your findings.
Yeah, one of my the papers that I found was about college students that were in sports programs and using the sociological model of health with their coaches and the teachers to give them a different perspective on the use of alcohol and to become a role model as well, using student leaders, but also using the coaches and the adults that are involved in that setting.
Okay, one more quick question. One more quick comment? No? Okay, thank you so much. Thank you.